What's up, guys? My name is Dr. Antonio with Live Loud Chiropractic and Coaching. Today, I'm going to be showing you some variations and some nuances of sciatic nerve flossing, right? So the concept with nerve flossing is we can have a nerve that's irritated and that might be under too much tension, and so we're getting a lot of this guarding that is restricting the amount of motion it has, so we don't aggravate it further, right? Or in other cases, we might have some snags or some limitations in its gliding ability through the connective tissue and the fascial layers within the system because of an injury or because of maybe not enough use or motion in that area, and it's becoming restrictive, and that's what we're trying to do. But the key takeaway here is knowing which one you're trying to emphasize to get the improvement that you want. Now, the hard part is very commonly we'll see people like stretching hamstrings like, oh, it feels like such a good stretch. But in reality, the symptoms that the response that they're feeling is actually more of a nerve stretch type of feeling. So we want to be careful of not overstretching the nerve because you can make it too sensitive. So very typically we'll recommend is not having tension on both sides. So what do we mean by that? So we got brain, spinal cord, branches of the lumbar nerve. The branches of the lumbar nerve make the sciatic nerve and then comes down the leg, and then it actually goes underneath the bottom of the foot. So when I bring this up, if I bring my hip up here, I'm actually creating a lot of tension around here because of that 90-degree angle that my hip comes up. As I straighten my knee, I'm going to increase that tension, and as I pull my toe up, I'm going to increase that tension. So part of the diagnostic process is if I feel this intense stretch feeling and it changes as I pump my ankle, that may mean that you're stretching the nerve. Not horrible, but if you push into that, you might be aggravating it. Now, if we need to work on the extensibility and trying to make that nerve a little bit longer, then we might need to push into that ever so slightly. And this is part of flexibility training, is sometimes the limitations you have is not necessarily due to the length of the muscle, but maybe the length of the nerve and how long it can stretch, right? So from here, I can increase that tension from this top side too by flexing my head and doing like a slight little crunch in this area. So I'm pulling from this side, the nerve's going this way, and then it's pulling from this side. But to do the flossing, what we're going to do is work in opposite. So as my knee straightens and my toes come up, I'm going to make sure my head's down. And then as this bends, I'm going to curl up a little bit. So as I curl and flex my head, the nerve is actually being pulled up through my spine a little bit. And then as I do this, it slacks this way to allow for that to get pulled that way. So essentially, we're just going to be going like this, right? The cue to think about is you kick your head away. As your toe comes up, your head goes back. Now, for some, depending on where the sciatic tension is, you might have to decrease that. You might not be able to get all the way up here. We have some patients who are getting sciatic nerve symptoms the moment they start doing this based on the hip angle and the knee angle. And then what we'll sometimes do is just play around with the toe and the ankle to figure out where that threshold is, and then we can start to work in a different way here. Sometimes we'll reverse it where we'll actually tension down here as we bend the knee, and then as I straighten the knee, I'll point the toes to create some slack. All of this is essentially trying to get that nerve to be able to slide through the connective tissue more effectively and make it less sensitive to the little bit of stretch tolerance that we might have right now, so that we can improve range of motion and decrease that sensitivity. Now, all of this is said by knowing and understanding what might have been causing it in the first place. So making sure that you have a good grasp on why it might be happening so that you don't aggravate anything further, especially if it might be a disc injury or something like that.